Animal Disease and Health. This will be Chapter 11. We're going to talk about diseases of the genitourinary system, aka the reproductive tract. So we're going to look at the system here, and we got to think about the components of the system. So where are we going to find symptoms? What components does it actually affect? So we're going to talk about the urinary system, so the kidneys, ureters, the bladder, urethra. Also the reproductive system, so that's why it's called genitourinary system. So the reproductive system, males, it could be the penis, testicles, scrotum, epididymis, vas deferens, the accessory glands, and even semen. In females, we're looking at the ovaries, fallopian tubes, uterus, cervix, vagina, and vulva. So what type of symptoms might we see with a reproductive disease? So in the urinary system, we might see anuria, or cessation of urination by obstruction, so there's something inside. Dysuria, which would be painful or difficult urination, or hematuria, so hema means blood. So we have blood in the urine. If we look at the female reproductive system, we might see anestrus or abortion. So anestrus is when they're not cycling, they're not coming into heat. Abortion is obviously what it is. Retained placenta, so the fetal membranes uh, that should be dislodged and detached during giving birth do not happen. There might be sterility or. So first we're going to talk about your female reproductive problems. So first is a free martin. A free martin is a female born twin to a bull. It's not synonymous with cattle, but it's more prevalent in cattle than anything else. Again, sheep, goats, pigs occasionally, but not a lot. So these animals look normal. They may come into heat, but what causes the issue is they have a shared blood supply with their bull during pregnancy, and so that allows too much testosterone that interferes with the development of typically the ovaries, but it could be any part of the female reproductive tract. So only if they have a shared blood supply will they be infertile, and that's a 5 to 10% chance that they are fertile. So most cases they go ahead and say if it was a female born twin to a bull, you should never use her for reproduction. It might be a retained fetal membrane. Again, it has a failure of the placenta to actually detach from the uterus. It usually happens within a couple hours after giving birth. Maybe it's a little more frequent in some other species. We've talked specifically cattle. Over 5 to 6 hours, it becomes an issue. So mares, again, normally within about 30 minutes, it can happen. Again, if it's over 12 hours in cattle, it is extremely abnormal. And it can cause some lower milk production, decreased appetite, fever, and what they call a displaced abomasum, where the actual fourth compartment of the stomach can become twisted and turned around so they can't get food in or out. So what causes retained fetal membranes? Again, there's a lot of speculation. It could be about any one of these things. So dystocia, difficult birth, premature birth, a twin birth, an induced birth, abortion, vitamin E and selenium deficiency, so antioxidants, vitamin A deficiency, milk fever, placentitis, and a prolonged gestation. Treatment for retained fetal membranes, at one time it was all manual removal. It was the most widely used method of treatment. Problem is, if you don't know what you're doing, you don't do it properly, you can actually traumatize the uterus and impair or even make an animal infertile in the future. So there's a couple things that have been used. Oxytocin will be one that's going to trigger more contractions to actually allow for detachment of that fetal membrane. Prostaglandin, that also is a hormone that says pregnancy will end if you have more prostaglandin, then that triggers the release of oxytocin. There's been some that inject the umbilical arteries with saline, maybe some intrauterine antibiotics. So again, there's no common or overall best recommended treatment for a retained fetal membrane. Howie prevention, again, you can't prevent every single case of these things. So as long as we do the best we can, making sure we have a great nutritional program, it's got the energy, the protein, calcium, phosphorus, and again, those antioxidant things, selenium, vitamin E, vitamin A, that can help. We also use body condition scoring to determine the nutritional needs of that animals and make sure they've been met. So it also tends to be that you have really, really thin or really, really fat animals that they have the most issues with this. So here's your male reproductive issues. So sexual dysfunction can happen in males, basically that libido or that vigor in males, and it can also happen in females. It's really not dependent on the functioning of any single organ in their body. So it's more of a combination of the natural stimuli in the environment and the body's reaction to that from the endocrine system releasing certain hormones. So if you have one thing that is out of sync, so if one hormone isn't released properly, that basically compromises the whole reproductive process. So it can happen so severely in animals that it can cause sterility. Uh, Basically, maybe you have a small boar with a very large dominant sow. Basically, he just becomes scared and doesn't ever want to breed again. It can happen. So orchitis is the inflammation and degeneration of the testicles. It could be due to mechanical injury, so they get kicked, punctured, something like that. It could be because of a disease, maybe they accumulate pus in some portion of the genitals that doesn't allow for the secretions of living sperm, and thus it can lead to infertility. So these are the actual diseases themselves, some of them of the genitourinary system. Brucellosis, that's the first one. According to the United States Department of Agriculture, the incidence of brucellosis is less than 0.1% in the United States. People know about the risk and they vaccinate for it. So the cause, you can tell exactly what it's going to cause when you see the name of the bacteria. And this is a bacteria, it's called Brucella abortus is the big one. So also called the Bangs bacilli, was actually discovered in 1897. So Brucella abortus, what is it going to cause? It causes cattle, and if humans get it, it causes abortions. You have different species, have different names. Melanosis is in goats, and then you have Brucella suis, which is swine or pigs. So the cause of the infection by brucellosis typically is that organism is ingested by the animal. And it could also go through skin abrasions or contact with the conjunctiva, the outer layer of the eye. Contamination basically of the uterus when females are bred. So this is one definitely that we think about as more of, again, a sexually transmitted disease. The most common is an ingestion of contaminated fluids from an aborted fetus. So if an aborted fetus is on the ground, some other cow goes up and starts licking it or sniffing it, that's how she can get it. So typically it's transmitted into a herd by an infected animal that's introduced that hadn't been quarantined and hadn't been tested, aka it hadn't been vaccinated. Specifically, if we look at bovine brucellosis, again, the Brucella abortus is the common bacteria we're looking at. So typically after the 5th month of gestation is when you find abortion. They might also have retained placenta, retained fetal membrane, decreased milk production following that abortion. If it's transmitted from a male, typically orchitis, which we've just defined that in bulls, is about the only symptom, but the bacteria can be passed in semen. So they actually can do some tests. It's what they call a milk ring, is what they look for in dairy cattle. Typically blood serum levels of it is what they look for in other native type of cattle. So we prevent it with so if they take reactors from any of those tests, whether it's the milk ring or the blood serum, then they take those animals, trace them back to their herd of origin. They test the entire herd, and any of those that react now are branded, tagged, and removed for slaughter. So the process of that continues until you have no reactors on to successive tests. And also because of this, any semen that is for AI in the United States has to have antibiotic added to it to prevent brucellosis. So your treatment, there's a lot of drugs that are recommended, none have been extremely successful. So it's more about prevention. So basically, if you know, an ounce of prevention is worth a pound of cure, and that's where that comes in. Next, we have bovine leptospirosis in the U.S. It's caused by Leptospira pomona, which is a bacteria. Your clinical signs takes about 7 days of incubation period within the animal. They can have anorexia, which lasts about 2 to 5 days. They get a fever, 105 to 107. They also might have some depression. Their urine may be coffee colored, so a tan to dark brown. And then if it's, they may have a cessation of milk production. If they are continuing milk, it actually is going to be very thick and yellowish to pinkish colored. If you have an unvaccinated herd, it may cause abortion in 25 to 40% of the animals, but mostly during the last stages of gestation during the third trimester. So your prevention in all species is to purchase clean animals, isolate them, go through that quarantine and retest them. You can do blood sampling in cattle and pigs. So your control is more based on your vaccination, sanitation, and your treatment. So there's an annual or twice yearly vaccination is the most effective, basically approach to controlling it. So prevention is more about the vaccination. So their treatment would be prescribed by a veterinarian. It could be a blood transfusion, antibiotics, and also just good care. Antibiotics are good as they're treated promptly when it's diagnosed. So usually a broad spectrum tetracycline type of drug, oxy or core tetracycline. That's why people do put antibiotics in feed. So it could be 400 to 500 milligrams per ton, so it's not a lot. But usually they'll put that in swine complete feeds for about 14 days, and that eliminates some of your carriers. So you could do a streptomycin injection, and that usually helps in a majority of swine that would get leptospirosis. Cattle, typically it's a long-acting oxytetracycline, 2 doses, 10 days apart, according to the label directions. Another one to look at is bovine trichomoniasis. It's a venereal disease, so again, sexually transmitted disease, causing infertility, early abortion, and pyometra. Your cause is Trichomonas fetus, or fetus, if you want to call it that. It's introduced typically by an infected bull or an infected cow, either way, and then if one has it, it spreads pretty quickly. So it is sexual contact that is how it's spread. Typically, bulls don't show any signs. They become kind of asymptomatic carriers of it. Cows might develop vaginitis in varying severity within about 3 to 9 days after being bred by an infected bull. So your clinical signs will be infertility. 24 hours after being serviced, the cow's vulva and vagina will become edematous and inflamed, so swollen. They might have delayed estrus in terms of coming into heat from an early embryonic abortion. Usually during the first 4 months of pregnancy is when that occurs. Prevention, typically we want to have anything we're using for AI and any bulls that are free of infection. Talked about the antibiotics. Any infected animals should be sold for slaughter or basically have 90 days of sexual rest, no breeding whatsoever. You got to take precaution in introducing new animals to a herd or breeding outside cows, taking in cows for breeding purposes. That's just kind of a big no-no. Your treatment, again, any type of bulls that are infected should be slaughtered rather than actually trying to treat it. But successful systemic treatment of bulls, there's a couple of different things. Dimetrodazole, ipronazole, and metronidazole. Those things are fun to say. They do lack official regulatory approval, but it's something that can be utilized, which means they're not approved to actually treat that, but it's something that has been utilized. Your infected cows typically need sexual rest for about 90 days, then serviced by AI or a clean bull. Then we have mastitis. It's probably the most costly disease to the dairy industry. On the average, they'll spend about $200 per cow per year. So if you think about a dairy there's a dairy close to us here in southwest Kansas that has 6,000 head. So now you start thinking about how much they spend on mastitis a year. It's a lot. So the cause is actually a bacterial penetration into the udder itself. But it also could be any trauma to the teats. They have improper milking machine function, contamination of the environment when they're going to milk. All those things, combine together and overcomes the natural defenses of that animal. So basically, it's what the organisms are they environmental or are they contagious organisms? So there's several that can cause mastitis. And I give you a nice picture with the Holstein. It has obviously a very severe case of mastitis. So your contagious ones are caused by Staphylococcus aureus. Yes, the same organism that is naturally carried by most humans, animals, etc. So we would think of as a staph infection. It also could be a form of streptococcus, a similar agent to what we call like a strep throat. Actinomyces pyogenes is also another one. And then you have environmental bacteria, things like Streptococcus uberis, any type of coliform pathogen. So now you bring in E. coli, Enterobacteriaceae, Klebsiella. And then you have Mycoplasma, any type of species. In this case, if you're talking about cattle, Mycoplasma bovis for bovines. So your signs, in the clinical levels, you'll find some off-colored milk that may become curdy, clumpy, or stringy. The actual udder itself will become red, hot, and swollen. They will get a fever, and just overall, you can tell the animal is unthrifty and doesn't feel well. Your subclinical, which is the costly thing, basically that they're going to test all the milk and anything in bulk storage, and there's limits in the United States for levels of the pathogens that are in there and any obviously antibiotics. Preventions typically look at three focus areas. The milking machine and the system, making sure it's clean and sanitized. That becomes the environmental factor. You know, so your treatment of mastitis is going to vary depending on if we're talking about something that's contagious versus environmental. So you can do antibiotics. They might actually be better to take them and expose them to oxytocin, and that will induce a complete milk out and allow their natural immunity to take over in that case. But they also make these udder infusion tubes that actually go onto the teat and then kind of work on the opposite principle as what a milking machine does, so that infuses that antibiotic inside the udder. So obviously the pizzle is slang for the penis, so that's where they get the term pizzle rot from. Enzootic pousitis is the actual name for it, sometimes called sheath rot or balanopousitis. It's an inflammation of the prepuce head and or the penis itself, of typically in male sheep more than anything else. And for some reason it affects castrated sheep more than it does intact sheep or rams. So it affects wethers more than rams. Typically it's associated with castration and a protein-rich diet. It is caused by a bacterium, which is a Corynebacterium renale, and it reacts with the urea and initiates an ulceration in the penis or on the penis. So your clinical signs is you'll find a small scab above the external urethral orifice. It may extend to the interior of the prepuce and at the penis or the head of the penis and becomes ulcerated. Typically the sheep will kick at their belly, become restless, trying to get rid of that pain. When they urinate, it's only just a little bit of a dribble of urine at a time. If it gets in advanced stages, you're going to find some pus and some fibrous tissue will form, It interferes with urination and also protrusion or extension of the penis outside of the body or the sheath. So blowflies can also intensify the problem and spread it from animal to animal. So how we prevent it? We try to remove the wool from around the prepuce on a male or the vulva in a female. Again, make sure that we don't give them too much protein, so restrict their diet. If you have an affected sheep, isolate it, disinfect the infected area, and then do some preventative sanitation of rams at 6 month intervals. You can smear an antiseptic or an infusion solution over the prepuce and skin. You can swab it onto a vulva and surrounding area of a female. Your treatment will be your application of an antiseptic, which could be a 5 to 10% copper sulfate ointment. It could be a quaternary ammonia compound, which is what's used as a sanitizer a lot of times in food facilities, and it could be aluminum silicone. It also might be an ointment that is just containing penicillin, like bacitracin, something like that. So before treatment, you want to remove any scabs, urine, clean off those areas of pus and debris and dirt. That'll be the conclusion of Chapter 11, the genitourinary diseases. Complete any assignments in Canvas, and when appropriate, move to Chapter 12.